Welcome back. If you want to lose fat from your stomach, your thighs, or arms, reducing fat in one particular area of your body requires a full body approach. The only way you can spot reduce fat is through liposuction.
Yeah, but there's a new, gentler approach to liposuction. It's actually called SmartLipo, and Dr. Ferguson at the Ferguson Clinic in Honolulu has all the info. Check it out.
Okay, ladies and men, we all have a little bit of fat somewhere on our bodies that we wish we didn't have, we wish we could get rid of. Well, there is a treatment out there that you might be interested in. It's called laser lipolysis, and here with all the information on that is Dr. John Ferguson with the Ferguson Clinic. Good morning.
Good morning. How are you doing?
I'm doing great. I'm excited to hear about this. You know, after having 2 kids, your body's just not the same.
Absolutely, absolutely. And that's where I come in. A lot of patients, they work out, they exercise, but they have these little areas that just won't go away. And this is such a nicer, kinder alternative to traditional liposuction.
Okay, tell me what the difference is between traditional liposuction and this treatment that you have.
This is what you use when you're doing regular liposuction. You put a lot of fluid into the soft tissue where the fat is to expand the fibrous network, make a cut in the skin, stick this into the soft tissue, and put a vacuum on it. That sucks the soft tissue into here. Unfortunately, the soft tissue is still stuck to you. So that's why you see us doing that. It's even serrated and everything. It's very traumatic to the tissue. What the laser does is we put a little laser fiber through here, make a pinhole in the skin, and then just set it into the soft tissue. Unlike this, which is a mechanical ripping out of the regular liposuction, this is actually a photoacoustic effect. There's this force wave of concussive energy comes and it fractures each individual fat cell wall. They fracture, they die, they're not going to come back. But you're not damaging anything else. Because of their size, their shape, and their physiology, they're just really, really susceptible to the pulsations.
Can I see the 2 wands? I'm going to call it a wand,
yes,
side by side. So
they're
that's
cannulas.
A big difference.
Yeah, it is a very big difference. Now, we have longer ones than this to get some bigger areas, but usually this is about all you need. You go in, you do it, but what's really cool is while you're on the table, about 50% of the fat cells that are going to die will die immediately, and I'll just suck that out. So you'll see changes immediately. What I like to tell patients is my end result while you're on my table is only the little tip of my pinky nail will fit in your belly button. That's how flat I get it. Then over the next 8 to 9 weeks, the remainder of the fat cells that are going to die will die, release their fatty acids, and your immune system just picks up the debris. It also gets better than that. Something the regular lipo can't do, and it actually has a heat component that will heat up that bottom layer of skin, causing deep dermal heating, which is the gold standard for non-excisional skin tightening. So your skin will just shrink wrap around over the course of about a year.
Now, how long does the actual treatment take? And tell me about the recovery.
It varies. It depends on how we're doing it, how many areas. I usually don't go by the actual areas. I go by how long I think it's going to take. Usually anywhere from 3 to 4 hours. I mean, anywhere from 1 to 4 hours. Average is about 2. Almost all of them are 2, just to do like the waist. As soon as we're done, let's say we're doing the waist, we put you in a binder, let you go home, see you back the next day. If everything looks good, then you can go to the beach, you can go to work, you can jump out of an airplane. Just no hot tubs or bathtubs for 2 weeks, and that's the only restriction. I'd say half my practice is active military, trying to get their tape testing done, and they're back the next day usually.
Okay, great. And who's a candidate for this? Can anybody get this done?
Well, you need to be healthy. I don't want slugs in here. I want you to work on other areas and other aspects of your life. But this isn't weight loss. No, nobody's really doing liposuction for weight loss anymore. So we kind of limit ourselves to about 5 liters that we take off. So you can have a lot on there. You got to have some good skin, otherwise the skin won't tighten up. But that's usually just post-pregnancy.
Okay.
Yeah.
All right, so it's called laser lipolysis. All right, and it's minimally invasive.
Correct, that's all it is.
Takes 1 to 4 hours, on average 2. All right, can you do it any part of your body?
I have probably done more treatments than anybody else in the world, and I've done from the ankles all the way to the top of the head, all the way to the wrists. All right. So there's not, I haven't done the forehead.
Well, usually we don't have the extra skin, too much extra skin. Well, Dr. Ferguson, thank you so much for speaking with us. If you want more information on this treatment or any of the other treatments that you offer, you can go to thefergusonclinic.com. Is that right?
That's correct.
All right, thank you.
Thank you.
Wow.
Smart lipo. And again, you can do it any part of your body. So a lot of people, after having children, you know, they have that little pooch by their stomach that they have a difficult time getting rid of.
Well, sometimes you can't. There's no way to actually get rid of that targeted area.
Or even, you know, I thought it was interesting, you know, the area under your arms or under your chin. So, you know, you can't just lose weight in that one area. Like we said in our intro, you got to do a full body approach. But this is a way where you can kind of focus on the one area.
And some of it's just genetics. You can be incredibly fit in shape, but you might have that little, you know, and he can surgically take care of it. So that's pretty cool. Amazing how much technology has changed that field.
Yes.